Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you very much for joining us today. You are listening to the Bima Health Show with me, Dr. Zirva Khan, on Ramadan Radio 87.9 FM, online at ramadanradio.org, and streaming on Facebook. We have a really interactive show today, inshallah, on heart diseases with Dr. Amer Hamed. So please, so that we can keep it really interactive and you can learn lots, call us, text us, or WhatsApp us with your feedback, questions, or comments on 077 614 60614. That's 077 614 60614. So, Assalamu alaikum, Dr. Amer Hamed. How are you today?
Walaikum assalam wa rahmatullahi wa barakatuh. Alhamdulillah bi khair. You okay, sister?
Alhamdulillah, not too bad. How is your Ramadan going?
Oh, mashallah, blessed Ramadan as usual. Ramadan always comes with its blessing from all sorts of things. First spiritually, but also even in a health aspect, inshallah.
Alhamdulillah, that's really good to hear. So we're really excited to be talking about heart problems today because we know heart problems are really common and probably not as well understood by our community. So I'm going to start off with a whole load of questions that we know that people always want to know about. But of course, if there are any questions, please do text them in or send them through the Facebook group. So let's get started then. What do we mean by heart diseases or heart problems?
Jazakallah khair. Very good question. Now, heart problem, it means the diseases or condition that affect the heart, the blood pressure, the vessels of the body that ultimately can lead to endangering life or affecting life of the person or society or community. It's a very common problems, and it's one of the second killer, unfortunately, in UK after dementia.
It's quite scary, the statistics, you know, the second biggest killer after dementia. I mean, amongst our community, how big is the problem?
It is big, and our community, unfortunately, because the risk factors which is contributing to this condition, like diabetes, like high cholesterol, like overweight, this is more common in our community, especially in what we call it underdeveloped communities or deprived communities. These are communities in which health conditions can affect people's lives and ultimately their physical body.
Yeah, it's quite scary. I mean, Dr. Hamed, would you say that, I mean, I know in my family, for example, I know lots of people with heart problems. You know, lots of people, I think once they cross the age of 40, lots of people start to develop heart problems. So how much does this cost society? How costly is it?
Yes, very important concept, but let's have some statistics before we'll come to cost. So 7.6 million people living in UK will have heart and circulatory problems. So about roughly 27%, roughly 1/4 of the population of UK deaths, why they die is due to heart and circulatory conditions. And that is as big as a city in UK, Oxford, 152,000 inhabitants of Oxford, the deaths of this in UK. And that is slightly even more, 163 actually in UK, so more than the population of Oxford. And again, it's also depending where you live. So if you are living in some places underdeprived, you will be more likely to have it. The cost of it is a lot. So the cost to the community is 9 billion to the UK. And if you add the cost of premature death, disability, and informal cost, it will lead to 19 billion. So it's a huge number, unfortunately.
Yeah, a really big number. And it's quite stark. You know, I think in comparison to the population, that it obviously affects a lot of people. So in the community, in our British society, how many people will have heart attacks or heart failure or irregular heartbeat? I mean, you might need to explain some of these concepts as well, because I mean, I'm a GP and alhamdulillah, you're a consultant cardiologist. You know, this is second language to us. We know this at the back of our minds, but maybe the listeners that have tuned in don't really understand these concepts. So could you maybe explain them for us?
Yeah, heart attack, it's a condition that results from reduction of the blood flow to the part of the heart due to most likely clogging or cholesterol and lipids and what we call atheroma that lead to reduction of the blood flow and ultimately stopping it, causing heart attack. If it before that, we call it angina, which causes transient pain that comes usually with physical exertion, but the flow is still maintaining the heart muscle, not dead. By the time it dies, we call it heart attack, and that which is irreversible damage to part of the heart muscle due to reduction of the blood flow. So that is heart attack. Atrial fibrillation, what we call it in the layman term, irregular heartbeat, in which it is the upper part of the heart, instead of beating regularly as it is, it actually beats very fast and irregular fashion. What we call it like a butterfly feature sensation in the chest. And this can happen due to many causes, age is one of them, and obviously having a risk factor like high blood pressure and high weight or obesity is another one. And about 1.5 million in the UK have been diagnosed with atrial fibrillation. Around 1 in 8 of people are treated usually effectively. So we are under treating that as a condition. Condition called heart failure, in which the heart as a muscle will fail to pump efficiently to the organs and ultimately pump in an inefficient way, which can lead to affecting other organs. And the statistic is around 650,000 people in UK are living with heart failure on the heart failure register. And they are people with heart failure are 2 to 3 times more likely to have a stroke than people without heart failure.
That's really interesting to know, and it's amazing how one organ, there can be so many things that can go wrong with one organ. One of the ways that I always found it easy, that I find it easy to explain to my patients about heart attacks or angina is if we think about the drainage from our sinks or from our guttering. So essentially, we need that to be nice and clean for there to be good blood flow to go to our heart. But as soon as it starts to get clogged up, furred up from the inside, which is all these risk factors that Dr. Hamed spoke about, like cholesterol, that starts to become tighter. And when the flow through these pipes becomes very less and very weak, that's when our heart feels like, oh, I'm not getting my energy, I'm not getting my nutrition, and I'm not going to work as well, and I'm going to cause symptoms. So Dr. Amer Hamed, what symptoms might someone with angina or heart attacks have?
The symptom usually will be pain in the chest. Most of the time. In angina, as we said, it comes with physical exertion. So it comes when the person is doing something physical, while heart attack doesn't have to be. Heart attack can happen anytime. It can actually awaken people from bed with severe excruciating pain. The difference is usually duration also. So one of them is whether there's effort or not. The second one factor is that the length of it, usually angina, less than 10 minutes, usually most often it's around 5 minutes, severe excruciating pain in the chest that force you to limit your physical activity. While heart attack, it continues beyond that. It's around 10 to 20 minutes, 30 minutes, and you will be feeling unwell with a lot of feeling clammy, sweaty, and weak, and you have to call the ambulance for such pain.
Now, am I right in thinking in diabetics, do they have slightly different symptoms if they were to have a heart attack or angina? Because I think they can be quite mysterious.
You're quite right. In diabetes, because diabetes affecting the nerves, and the nerves is the way in which we feel pain, people with diabetics can have modified feelings. So they might not have this severe excruciating. They might have a bit of discomfort, heartburn-like sensation, or a bit of unwell feeling only. So we have to be very careful with diabetics. And this sometimes can be the features also, unfortunately, with women. So women might not be having the typical features. So we have to be very careful with ladies. They are very gentle creatures compared with men.
That's debatable. That's a separate debate that we can cover on another time. So what I want to remind listeners that have tuned in is that this information that we are discussing today is not to substitute kind of health advice that you should be getting from your doctor. So that advice, if you do feel like you might have any concerning symptoms or there's anything that you are concerned about, you should be trying to seek help from your registered GP. So please don't contact us with any personal health questions. And for anyone who's just joined us, you are listening to the Bima Health Show, specifically heart diseases with Dr. Amer Hamed and myself, Dr. Zirva Khan, on Ramadan Radio London 87.9 FM, online at ramadanradio.org and streaming on Facebook. And if you do want to send any questions, comments, feedback, then please do that either through the Facebook group or 077 614 60614. That's 077 614 60614. And okay, so coming back to heart diseases and heart problems, what is cardiac arrest?
Cardiac arrest is a condition in which the heart stops working suddenly, and it's one of the causes, unfortunately, that people that die in the society. Majority of people who die in the community before reaching hospital suffering from cardiac arrest, in which the heart stopped completely, and resuscitation is vital. That's why BIMA, British Islamic Medical Association, have initiative since the last 5 years of teaching basic life support, what we call it CPR, cardiopulmonary resuscitation, in which to teach people in the communities, and we do it in the masajid, try to teach people how to revive people, because around 1 or 2 only survive to the hospital of these people. The rest is in the community, and if we don't save them, we will lose a lot of lives. I'll give you some statistic. Coronary heart disease affecting 63,000 or causing 63,000 deaths in UK. An average 170 people each day die because of that. 1 in 8 men and 1 in 13 women die from coronary heart disease. Every 8 minutes, someone in the UK die from coronary heart disease. So it's a very prevalent disease. 22,000 people under the age of 75 in the UK die from coronary heart disease every year. Coronary heart disease rates are highest in Scotland and Northern Ireland of England. So as I said, there is some more very geographical distribution, part of it linked obviously to underdeprived communities. So there are 2.3 million people in the UK living with coronary heart disease. Around 1.5 million of them are men and 830,000 women. So contrary to believe that it affects only men, it is actually coronary heart disease affects more women than breast cancer.
Thank you for those statistics. So with cardiac arrest, you mentioned that the chance of survival at the moment is very low, and it's primarily because not many people have the training for it. So what do we know about, I know this might be something you haven't necessarily prepped for, but with cardiac arrest, I remember some strange statistic where the reason why they want people to do CPR straight away is because if you don't do CPR straight away, is it within a couple of minutes that you can have brain damage? So even if you were to bring that person back, their brain would be, it wouldn't have had the oxygen sent to their brain, and then that would cause them to be brain damaged. So could you tell us a bit more about that?
Yes. Again, another statistic, there are 30,000 out of hospital cardiac arrest in UK every year. The overall survival rate of it is 1 in 10, as we said. So every minute without pulmonary resuscitation and defibrillation, it will reduce the chances of human beings staying alive by up to 10%. So each minute delay is 10% we lose of people. So the more delay, the more we will have problems. Now, if you take the statistic of how long it will take for an ambulance, depending where you live in the country, if you are lucky in an area that the ambulance takes 7 to 10 minutes, but most of the time it takes anything between 7 to 15 minutes. It can be longer in peripheral areas of the country. And you can see how much we will lose if we continue without reviving such people. So that's why it's vital that that we learn, each one of us, how to do cardiopulmonary resuscitation. And British Heart Foundation, as well as British Islamic Medical Association, we're fighting, inshallah, to try to introduce these teaching in the universities and in the schools, hopefully, inshallah. But for the time being, we are doing community-led services to try to teach people how to do that in the masjid, inshallah. There are more than 30,000 deaths, as I said, every year. So it's a lot of people we are losing in our community if we don't do that.
I mean, I think it's great that the British Islamic Medical Association is working quite hard, and in association with the British Heart Foundation as well, to try and promote CPR and educate people on how to resuscitate each other. I remember going out to a school and doing it there. They were like A-level students. And it's a life skill. It's a vital life skill. I don't know whether you've seen it, but I've seen in a few masjids, alhamdulillah, they actually have defibrillators there, which I think is very good. I think especially with the bigger masjids where, you know, anyone can drop dead. You know, we don't know when this is going to happen. You know, you don't get a warning sign necessarily before, like we've already discussed. Not everybody has chest pain before they have a cardiac arrest. You know, they just often collapse. So actually having the preparation there, especially in these communal areas, is so important. I want to go back to you mentioning before some of the risk factors. So you mentioned high cholesterol and smoking. Now, we know in our communities, unfortunately, lots of people have high cholesterol and lots of people smoke. So what is the effect of this on the heart?
Yes, high cholesterol associated with 1 in 4 heart and circulatory diseases death in UK. High cholesterol is also a factor that could happen when people are overweight. So hence we are trying to encourage our communities to try to do more physical exercise and do physical activities, because that reduce your weight, reduce your cholesterol, ultimately you reduce your risk of death. Smoking, at least 1 in 7 adults smoke cigarette in the UK, and that is around 7 to 9 million in the UK. So that's a lot of people. At least 100,000 people in the UK die from smoking-related disorders each year. Around 20,000 deaths in the UK each year from heart and circulatory disease can be attributed to smoking. So a lot of our communities, unfortunately, think that smoking is a mild issue. And the other factor, which I haven't talked about it, and it is also common, is high blood pressure. Sometimes even as a doctors, we take it less serious. High blood pressure is one of the problems that, what you call it, I call it actually the silent killer. So high blood pressure affect around 28% of adults in the UK. More than 10 million people in the UK die without being diagnosed with high blood pressure by their GP. This means nearly 5 million adults could be underdiagnosed. In the UK, it's estimated around 6 to 8 million people die, living with undiagnosed, with uncontrolled hypertension. So high blood pressure can make you liable to stroke, can make you liable to heart attack, can make you liable to your kidney packing up, can give you irregular heartbeats. And these are all debilitating conditions that we need to address.
I mean, I think it's important that you've brought up high blood pressure. And as a GP, I guess my line of work is a bit different to yours. You know, you see them when they have been diagnosed with a heart problem or a likely heart problem. For us, our job is to try and pick them up before they start to have symptoms. And that can be quite challenging. And I've always found it more challenging in our communities because people will say, oh, you know, I'm stressed. They don't believe in high blood pressure. They don't think that it's going to cause them a problem. And it's a very difficult conversation to have that chat with them. There is also a lot of, unfortunately, a lot of people in our communities that believe it's written by Allah. If I'm going to drop dead, I'm going to drop dead. You know, there's no point in you trying to fix that, because if it's going to happen, Allah will make it happen anyway. But I reckon you must feel similar to this, but I think, you know, Allah has given us our body. Allah has given us responsibility. You know, this is a responsibility we should look after. And our body's health is 100% our responsibility. Obviously, kismet is kismet, but the way, when your GP contacts you for an MOT, or they say, look, come in, have some blood tests, just get your blood pressure checked, don't look at it as a nuisance. Look at that as an opportunity to be picking up the signs of these problems, including high blood pressure and other health problems, before they start to bother you. Because when they start to bother you, that becomes a little bit later. Then there's less that can be done when you start to have symptoms. So the idea is prevention is better than cure. Am I right?
Definitely. I can tell you some detailed statistic over that. So as we said, it's 28% of adults in UK expected. So the expected is around 15 million. Now the diagnosed is about 10.2 million. The undiagnosed one, not even on the GP register, is up to 4.8 million. The untreated one is 6 to 8 million. Now it's huge numbers, and this is we're talking about. Sometimes even, unfortunately, some of us, even as health professionals, talk about a bit of blood pressure. Is this a disease that can give you a debilitating condition, that can kill you in seconds with irregular heartbeat, that can give you a debilitating stroke that limits your life and your work for the rest of your life? And make you have problems regarding that, even from the psychology point of view, let alone the cost for your family and for your employment and for your insurance and all that. So it is a huge problem also, and we need to talk about it in a separate session, inshallah.
Yes, alhamdulillah, there's so much to talk about with high blood pressure. So I've just got a couple of questions left to ask you. Are there any of the risk factors that our communities need to know about? Because I know there's like lifestyle, diet, high cholesterol, smoking, these sorts of things we've already mentioned. But are there any other risk factors?
Diabetes. Diabetes is another risk factor. The people who are diagnosed in UK, around 4.1 million, out of the expected 4.8. So we have roughly about 700,000 that haven't been diagnosed. And it is another disease that it is make you also liable to problem. And I always chat with my patient. I say, look, if you're going to wish any two things for your enemy, it's high blood pressure and diabetes combined. So and once you have it, one of them, always expect the other one to be on the horizon. So if you got high blood pressure, always check your glucose level. If you are diabetic, always check your blood pressure, because it might be coming there. And the third one that accompany them or actually lead to them is obviously the weight issue. So if you are overweight, think about diabetes coming, especially so if you are above 50.
Dr. Hamed, I am right in understanding as well that genetics plays a part, doesn't it? So there are some families where lots of people have high blood pressure, lots of people have early deaths. And actually, those are people that need to be looking after their health too. So could you tell us a little bit about that?
Yeah, there is what we call inherited conditions. One of them is obviously what we call hypercholesterolemia, or high cholesterol, whether it's the whole lipid or certain part of the lipid, which is called cholesterol. And that is also one of the risk factors that can affect people, which is what we call difficult to modify. But unless we diagnose it and we treat people with high level of cholesterol lowering tablet, it can affect their livelihood. And usually these people have a cholesterol level usually very high, something like between 6 to 8, which is beyond the expected 4 to 5, 4 to 6, that it is slightly high in other people. And these are people who had their genetic makeup make them unable to process or metabolize the cholesterol and the other lipids in a healthy way, and they have higher level, and ultimately that higher level will go and clog one of the smaller vessels, and if you're unlucky, that could be either the vessel of the brain or the heart. You will end up with stroke or heart attack.
Thank you for that. So is there one message you'd like to give everybody who's listening in today about heart diseases and how they can yeah, I'll let you give the message.
The message is our deen. As we are in Ramadan, the Prophet Muhammad sallallahu alaihi wasallam hadith al-hamiyatu dra's ad-dawa, that we have to eat less, we have to exercise, we have to be active, we have to be careful about our health. And the hadith that we all know, that we don't have to fill our stomach. If we have to and we like the food, so it is 1/3 for your food, 1/3 for your drink, and 1/3 leave it empty. So the more we eat, the more we are putting weight, the more we'll increase our cholesterol, the more we are getting more weight on board, and we're not active, and it'll become a vicious circle. And inshallah, Ramadan is a good time for us spiritually to try to look at our food, look to our exercise level, to look to our habits. If you're a smoker, stop smoking, stop indulging in unhealthy eating, and inshallah, come back to be physically active as well as spiritually active in Ramadan, inshallah. And Ramadan Mubarak for everybody, and healthy Ramadan, inshallah.
Jazakallah khair so much, Dr. Amer Hamed. We really enjoyed the chat today. And thank you, everybody who's been listening in to us on the Bima Health Show. I'm Dr. Zirva Khan. This is Dr. Amer Hamed, who's joined us today on Ramadan Radio 87.9 FM. Until next time, Assalamu alaikum, rahmatullahi wa barakatuhu. And next is the Daily Iftar Show.